Hey, my name's Elizabeth Mickey. I'm going to be talking about the role of lactation nurse in the community today. First of all, why breastfeed? I feel like that's an important question in presenting this role. There's benefits for mom and baby that are everything from bonding to the fact that it's the most nutrient dense human food that we make. It's immune boosting. It reduces risk of hemorrhage, diabetes, and cancer in mothers, and may also reduce the risk of obesity, diabetes, sudden infant death syndrome, asthma, eczema, colitis, and even some cancers in babies. So why not? Um, this is according to Healthy Children 2018. Why lactation nurses are important in that? They are proven to improve breastfeeding outcomes. Breastfeeding is a normal, natural thing. However, there can be challenges, and this nurse focuses on providing skills and resources for mothers and in routine and in high risk situations. Their involvement and ability and accessibility increases breastfeeding rates, which in turn improves the health outcomes of our community. Because if we have less obesity and diabetes and cancers, obviously that's going to improve our long term health. Um, they improve patient satisfaction and trust in healthcare settings. So typically, lactation nurses are certified, and they're certified through the International Board of Certified Lactation Consultants. So lactation nurses are typically certified, and so they're also referred to as IBCLCs. So these people with this certification are knowledgeable and ethical professionals who have a code of conduct, a scope of practice, and standards of practice. This certification is something that can be revoked if they are not properly functioning within that role. They lower healthcare costs because by having healthier babies and healthier moms, we're reducing readmission into hospitals after babies have been released and moms have been released. Um, they help moms continue breastfeeding longer because the lactation nurses that are out in the community are able to help these moms once they go home. So once they are not in an acute care setting where they have access to healthcare professionals 24/7 for the first usually 3 days, 2 3 days of their baby's life. Once they go home, they can reach out to these professionals and continue having care and help. Lactation nurses also help improve breastfeeding programs and policies in communities. So their knowledge and expertise give them the ability to speak to issues and develop policies and programs that promote breastfeeding within our communities. Healthy People 2020, they have breastfeeding goals, and one of them, the main goal is to increase the proportion of infants who are ever breastfed, but they have different goals within that. So babies who are breastfed at 6 months, 1 year, exclusively breastfed for 3 months, and exclusively breastfed at 6 months. And so these were released in the 2012 goals, or the 2012 revised goals for the 2010, I believe, released goals. So these are things that have been found to increase the health of the population, and so these are goals that lactation nurses are helping our communities to meet. So where do you find them? Lactation nurses typically work in hospitals, but they also work in pediatric offices, health departments, and they also work in independent practice. So you can find them basically anywhere. So their primary roles, that of advocate, so they advocate for women and babies in communities. They're clinical experts. They're nurses. Usually you can become a lactation consultant without being a nurse, but typically they are nurses who go on to have additional certification and training. So they're trained to counsel in routine, difficult, and high-risk situations. So whether it be a mom has a condition where she is on medications that can make it tricky, they collaborate with care providers to make sure that mom is safe and able to breastfeed. Or if there's situations where maybe anatomy is tricky for breastfeeding, they provide tools and tricks to help moms and babies be successful, whether it's through pumping or using different lactation devices. These are kind of things that they use to help. So they are collaborators, so they partner with families, healthcare providers, and policymakers. They're educators, so they share current evidence-based practice with families. They provide anticipatory guidance, so like things that moms may face. So they kind of provide like education before things happen to help prepare them. They're facilitators, so they help moms and families reach their breastfeeding goals. They facilitate program and policy development as well. They're investigators. They facilitate, support, and participate in research. They are policy consultants and they are professional. So they have what I mentioned before, a set of standards, a code of ethics, and a defined scope of practice. Um, so they have a standardization of specialized knowledge and skills through one internationally administered exam. So those nurses or lactation consultants who go on to have that certification to become an IBCLC, they have one internationally administered exam that they have to pass, similar to the NCLEX, except for lactation things only. So this is all part of the position paper for the International Lactation Consultant Association. These are the primary roles as laid out by them. Other disciplines that they collaborate with. So first of all, they collaborate with mothers and families. So whether it be, it's usually not just the mom. They usually have support people with that. They help collaborate with as well. They work with OBGYNs, pediatricians, registered nurses, occupational therapy, and dietitians. Oftentimes, if babies are in the NICU, they have feeding issues, and so they collaborate a lot with dietitians to find out, do we need to reconstitute this milk to make it more calorie dense with other things? Do we need to use specific feeders, like different tools to help the baby be able to learn to latch effectively? So there really are a lot of elements rather than just like, oh, let's sit on your couch and talk about breastfeeding. They really do have a lot of skills. So educational preparation for this role, I mentioned before, so there's the International Board of Certified Lactation Consultants. So there's 3 pathways to become an IBCLC. All require a minimum amount of lactation education, clinical practice, and sitting for a licensure exam. The 3 different pathways vary whether you have a medical background, if you're already a nurse, or if you come from like a lactation role in a different area. So basically for nurses, though, I just went into that one because otherwise it'd be a lot of slides. So you have to have a minimum of 90 hours of lactation-specific education within the 5 years immediately prior to your exam. So you have to have a lot of current education based on lactation. And then you have to have a minimum of 1,000 hours of lactation-specific clinical practice within 5 years immediately. So these are people who have to have a lot of up-to-date knowledge and experience. And then you have to go on to pass the licensure exam. So necessary skills and abilities, they have to have history taking and assessment skills, so general nursing skills. They have to have skills to assist the breastfeeding diet. So like I mentioned before, you have to kind of know what baby needs and what mom needs and be able to have the skills to help them from both sides. General problem solving skills, use of techniques and devices, and they have to be able to develop, implement, and evaluate an individualized feeding plan in consultation with the mother. And this is recommendations from the International Board of Lactation Consultant Examiners. So teaching and learning strategies needed. You are working with adults, so you have to have knowledge and use of adult education principles. You have to be able to assess their needs, their learning needs and styles. So whether they learn best visually, hands-on, you can bring posters. They're visual learners. If they need to hear what you're saying rather than just show me, you need to like explain it to me. So if you have to assess your patient first and know like how do they learn best. Let's use that. So you have to have knowledge of evidence-based practice for contraindications. So if this mom has a medical condition, or maybe she has something that's transmittable to baby, you need to know whether they have a contraindication, whether it's not safe for baby to be breastfed. There's also cultural, psychosocial, and nutritional considerations. So some cultures have a really hard time believing that they have milk. And so you have to kind of work within their cultural guidelines to understand maybe what barriers you have that you're going to be working up against with, and how to work with moms appropriately with that. Counseling and communication skills, support and encouragement. Those are probably the biggest ones. So in conclusion, this is a unique nursing role. It's not necessarily what people think of when they go to nursing school as maybe what they'll do afterwards. I think it typically ends up being something that people almost fall into. Maybe they were helped by one and they think, wow, that's be a really neat job. I might try to go do that. And then they realize it's actually something that you really have to prepare for and put a lot of time and dedication into becoming. But also, like, why should we have these? They benefit the community health immediately by helping moms bond with their babies, by helping um, just helping them through that unique, really sensitive postpartum period. But also, you benefit community health long term by giving babies the best nutrients that you can possibly give them, and helping those moms meet their goals. We, like as lactation nurses, they contribute to the Healthy People 2020 goals, and it's a very rewarding career. So I think that is why we should appreciate lactation nurses, and maybe why someone who's a nurse who wants to do something else should look into it. And here are my references. Thank you.